Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. Incredible show lined up. Let's get right to it. So there's a game changer for choosing cancer therapy, and it's been developed, and it's being called a breakthrough, first of its kind live cancer tissue profiling that predicts the most effective cancer therapy for any given patient. Joining us to discuss is Dr. Chris Apfel, founder and CEO of Sage Medic Diagnostic Cancer Testing Company. Thank you for joining us, Dr. Apfel.
Thank you very much for having me.
Certainly. Well, few people realize that nearly 70% of late-stage cancer patients have no objective response from first-line chemotherapy. Why is it so hit or miss?
Well, because cancer is actually very difficult, and the 70% not having an objective tumor response refers, for example, to lung cancer patients at a late stage, often diagnosed at a late stage. It's often a so-called polyclonal disease, and as a result, there are many resistant cells already there that are polyresistant against many therapies.
Tell us about your company, Sage Medic. Why did you found it? And then just sort of explain what Kimberly just mentioned. What are live cancer tissue? What is that profiling?
Right. My dad was diagnosed with lung cancer at some time ago, and he refused therapy when he realized that treatment responses are so low. I thought the future is here now. We are all talking about precision medicine and genomic testing. And it was only then that I realized that only 1 out of 4 patients have mutations that we understand. Even less have then targeted therapies that might work. And even if you have a mutation for a targeted therapy, even then, it's not a guarantee that it will work. If a patient has an infection, you basically take a sample, cultivate it, and test which antibiotics works best. So I was asking our oncologists, why are we trying out a drug on a patient instead of testing it first in vitro? And the answer I got was, oh, it has been tried before, but we know it doesn't work. So I went through all the papers, and I believe I've found the solution for that, which actually made me leave my day job at the University of California in San Francisco. We founded this on our own dime, and we have now, with the support of a wonderful team, been able to develop a platform where we have over 80% of accuracy to predict which therapy, if any, can work on a patient that has failed current therapies.
You mentioned a couple of different times genomic testing, and I know we've covered it on the show before, but for those who have never heard of it, can you sort of explain how that works and how what you do at Sage Medical is different?
Yes. So in genomic testing, you look at the changes in the genome that you are familiar with that drive a tumor behavior. And there are therapies that can target that. And unfortunately, it doesn't work for the majority of patients. What we do is different in we take a biopsy, we create hundreds and actually thousands of microtumors out of this biopsy that are similar to your original tissue and reflect the tumor microenvironment and mimic what is going on in your body and how the tumor will respond as closely as possible. It's your own tissue. And then we put drugs on it, dozens of different therapies. These can be part of the NCCN guidelines so that the oncologist can actually provide superior care within the standard of care. Or if you have failed your current treatments multiple times, then we can actually also test repurposed drugs. We can also test targeted therapy. So we can test a wide range of drugs and therefore open no new opportunities for patients that are under current standard treatment failing.
What type of turnaround time does it take?
Well, the beauty is that in contrast to the academic research that has been focused on organoids that usually need weeks to months to grow, we actually have a turnaround time of about 7 to 10 days. And the reason for that is we don't grow the tumors. Very often tumors don't grow reliably. And therefore, we want a test that works for every patient so that we have always an actionable information.
Why, if we have today tests that they are based on the DNA, that they can, when the tumor appears initially, and if you can get this test and then based on DNA and analyze the DNA of the tumor and then treat the patient earlier. Because one of the problems that I see with cancer it's usually the people end being treated at the very end of the disease, or at least in the beginning, but not really paying attention to what type of a cell is creating and in which area is located. Imagine the tumors in the kidneys in the beginning, and then you can just amputate the kidney, and the solution is there. The same thing with breast cancer, the same thing with stomach cancer. We know where the cancer is coming earlier, but we always are looking for treatments at the end of the life of the person.
I have no arguments with you. In contrast, I'm delighted you are bringing this up, Dr. Bonati, because there is now actually a pan-cancer screening test out there from Garey called Garey test, and it's not covered by insurance. There are health economic reasons for that, and it can help you to detect cancers that are otherwise not screened at an early stage. The old saying is, a chance to cut is a chance to cure. If you can actually have a diagnosis at stage 1 and stage 2, and you can actually surgically remove it, you may not need chemo or adjuvant therapy. We can get a live tissue sent to us. We can then help the oncologist to say which adjuvant therapy can actually lead to increased survival. 600,000 patients die every year, which means every minute a cancer patient dies. And I think we can change this dramatically by actually providing the oncologist with insight on therapeutic options and for the patient that can actually lead to a significant treatment that improves patient outcomes and, in our mind, also long-term survival.
Thank you so much, Dr. Chris Apfel, for being on the program. What you're doing is groundbreaking and can save countless lives. Thank you for being on the show.
It's my pleasure. Just go to sagemedic.com if you want further information, and we'll be happy to help.
Make sure you stay tuned. Coming up after the break, we'll have more. You're watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com.
I was wheelchair bound the last 3 weeks before I came to the Institute. The proof is in the pudding. These folks want to remove your pain.
Garey is no stranger to back pain and underwent traditional open back surgery with fusion 5 decades ago.
I had surgery in 1973, and it lasted 50 years. I was in the hospital a week, got a blood infection.
When his back pain and mobility issues returned, Garey tried conservative treatments with no relief. Realizing he would likely need surgery again, he knew he didn't want another spine fusion.
About 5 to 6 years ago, when the pain got to the point it was severely debilitating, where I couldn't go bowling, standing and trying to fish for any lengthy time was difficult, and walking, it became an arduous task. I tried about everything that you could buy in a store. Our doctor was faithful in trying to find some pain relief with that as well. It just continually got worse. That's when it really became apparent that we needed some sort of surgery there again.
Garey's hometown doctors told him nothing more could be done to help with his pain. Unwilling to accept this prognosis, he sent the Bonati Spine Institute his diagnostic imagery for a review, and Dr. Bonati called him personally to discuss his case.
I was told that there could be nothing done with mine. It was such a mess. And Dr. Bonati, he reviewed it, gave me a call. He said, yeah, it's a mess, but I believe I can take care of a lot of this. And he told me what he saw, what he thought he could do, and which convinced me that there was hope.
A unique feature of the Bonati Spine Institute is the state-of-the-art on-campus imaging center that allows surgeons to receive updated images to review with patients mere minutes after they are taken.
The problem seems to be that it's a little bit worse on your right side.
Yes.
Came Monday, they did the x-rays and got all their information, the blood work and everything, and preparing you for the next day's surgery. It's just amazing how fast they can put this together, and they just cover every base for you.
Garey was surprised at how quickly he was able to stand and walk after the patented Bonati Spine Procedures.
It was amazing how quickly they were able to get you right on your feet. And recovery, I mean, that was just fantastic. I realized the pain was gone almost right in recovery, where the severe pain was in the lower lumbar area. And I stood up, and like for the first time, I could actually stand straight. I didn't have the 90-degree angle that I came in with. It was very quick. And you get on your plane and you go home. And I thought, wow, this is very, very special.
Garey shares why he believes the exclusive Bonati Spine Procedures are so effective.
What was so unique about the Bonati Institute, you were actually part of the surgery. I could tell them where the pain was, so you didn't have to work blindly. And I was aware, and he would say, just say back or leg.
Looked like it was the center back low.
And then he knew how to adjust his procedure or whatever he was doing in the area that was giving the problem.
No pain here?
No.
No pain here?
No.
No pain here?
No.
All right.
After his Bonati Spine Procedures, Garey no longer requires a wheelchair to get around. In fact, as part of his recovery, he was instructed to walk about 40 minutes a day.
The rehabilitation was walking. I wasn't required to do any pool, water therapy, or anything like that. As the time progressed, I walked a little farther. He wanted me to get up to like an hour a day or a mile, and that started to happen. After we got back to Greenville, people would ask me about the Bonati Spine Institute. And I said, I just felt like I was the only person there. The staff, the doctors, they were just unique, just compassionate. I just have never been to any place with such professionalism that had all these attributes with it. It was just amazing to me to see how that all worked together. They are definitely dedicated to their patients. Dr. Bonati himself has a phenomenal success record with these spinal surgeries and all. People come from all over the world, and that's his passion in life, and he's very good at it. He is extremely good at it.
Garey is excited to return to his daily life pain-free.
To be able to do the functions that most people would take for granted, just being able to bend over, to walk.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we want to know what type of advancements are being made in spinal cord injuries.
The enormous amount of damage that an individual who suffers a spinal cord injury needs to support and live with.
Right.
And we don't have any answers about it. But there are some studies that were done recently in Japan. What they were working with insects, and they decapitate the insect. And they found that there was something very curious. These insects that they didn't have brain, they still can walk. And then they start to investigate further. Mm-hmm. And they would realize that there are other centers that they can perform really without the brain. They move from the insects to bigger animals just to be able to dissect the nervous system.
All right.
And understand if something different, why this system works in the insects.
Right.
And they took a couple of rats. Mm-hmm. They destroyed the brain on the rat, and then the rat got paralyzed. So then what they did is the legs of the rat was dangling, and they put a wire very close to the end of that leg. Mm-hmm. And then they push slowly the leg towards the wire, and the wire had electricity. When that happens, the electrical shock to the leg, immediately the rat moved the leg and hold it up. And what's a rat without brain?
Okay.
So they then, the question was, who is creating this reaction?
Right.
And how this reaction can be applied to humans?
Correct.
Well, what they did is they look at the nervous system and then they study the cord. And the cells that were on the top of the cord, they were able to create that reaction. When they destroyed these cells, the leg was able to touch the wire and don't get the leg up either. So those cells are neurons that they camped on the upper part of the spinal cord. But they discovered another group of cells on the lower part of the spinal cord.
Okay.
And those cells on the lower part of the spinal cord seems to be that they are the ones that they allowed these other cells to maintain the knowledge. So one was to create motion, the other one was to create knowledge of that action. So what happened then was any time that they touched the wire, the leg went up. Then the next day, they brought the rat again, and they put it in the same situation. They tried to put it around the wire, and the leg immediately didn't let the experiment the scientists to do that. They start to fight it. And why did that? Because they got knowledge that it's going to be shock. So now we have one set of cells that they produce the motion, and one set of cells that they have the knowledge of what you need to do and what you do and what you cannot do or what you shouldn't do. That type of information today is probably an incredible information to educate paralyzed people. Because if we can use the cells, and those cells on the top are going to create that type of a reaction, they can walk. But at the same time, they can recognize the motion, avoid objects that they are on their way, and at the same time, the next day, they know that they can walk. So now with the knowledge they can walk, they can perform some type of a ambulation.
We'll be back after the break talking about spinal cord injuries with Dr. Bonati.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing our conversation with Dr. Bonati about the advancements of spinal cord injuries. So are you saying that it's both voluntary and involuntary at that point?
Well, it is voluntary at the time that you have knowledge that when you put your leg down there in the electrical shock, and you don't want to be shocked again,
Correct.
You maintain the leg up, That's knowledge that you shouldn't put your leg down there. That's voluntary. I am so envy of the young individuals that they are going to medicine today, because the advances that you are going to see and the tremendous amount of information that is coming from the genome, this is also a situation that's associated with a gene. It's a gene that manipulates these cells, the top cells and the lower cells. So when you remove the gene, you see that the leg is dangling and is being shocked and doesn't move. And the next day you try to chuck it again and it still doesn't move. So it doesn't learn anything and doesn't move either.
I wonder how far away we are from paralyzed human trials to see how this may work.
Well, that's years.
Well, we will certainly keep a watchful eye on the innovations of spinal cord injuries and what may be on the horizon. Thank you for watching American Medicine Today. Make sure you check us out again next week. And if you would like to see more of our programs, you can search American Medicine Today on your favorite streaming apps. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.